So today we are going to talk about Transform. We're going to set up a treatment. This is our patient. He has done them a few times before. So he's experienced the treatment, he's felt it, and he's seen some really great results from it. So just getting started, we are going to be doing abdomen today and around to the love handles. So we're using 6 probes. Is that good placement?
Yep. One thing I experienced that's been really beneficial with this particular device compared to some of the other ones out there that I've used is that it's very particular and precise and can be customized to the individual areas that they're trying to transform. Because you can move these pedals around into different parts that you want to concentrate. So it gives much more versatility versus some of the other devices that are out there that don't give that flexibility to really customize the treatment protocol and how the device is delivering the treatment.
Yeah, this is constantly emitting energy, so really the entire 20-30 minutes of treatment, it's working the muscles and it's working on the skin, and the patient is feeling that result the entire time too. So what I'm doing, I'm just hooking up the probes right now. We're using 2 different energies, so there's negative energies on one side and positive on the other. So this is going to create that contraction in the muscle.
The one thing that's really neat as a patient experiencing it, I can feel not just the involuntary contractions, but I can feel the heat too. And that conjunction is what really makes this device, in my opinion, much different than the other devices that are out there, is the dual effect of how it's working. I can definitely feel that, and she can then modify on the screen there of how the body's responding, because the more treatment you do, the less fat cells you have. You have to modify the depth of penetration and modify the heat then too, because the body's making a change cellularly, and as the cells start to change and you start to transform, you have to modify that to cater to what the goal is that you have for the patient.
Yeah, and so on the screen here, we'll see these 3 different modalities. So radio frequency is really working with skin tightening, collagen building, helping with that skin laxity. The cutoff temperature is that heat. So the heat is gonna help with burning fat. Time, we can choose 20 to 30 minutes of treatment. We usually do 30-minute treatments for our patients. And then this muscle stim is the last thing. So this is what's creating that contraction and really what we vary throughout the treatment. So all 3 combined can be treated at the same time. We can help with skin laxity, fat, as well as muscle building. So I'm gonna start the treatment. We're gonna notice the temperature start to go up slowly. We're seeing that radio frequency right away. The temperature is at 35. We're gonna go up. The cutoff is 43 degrees Celsius, but we usually keep it a little bit lower just so that we don't burn a patient, and if they can tolerate it higher, then we'll go a little bit higher. So I'm gonna start to go up with the muscle stim. Feeling okay?
Yes.
Can you just explain to everybody kind of what it feels like?
Yeah, so what's happening now is this device is actually using the ultrasound gel as a conductor, and it's emitting contractions of the musculature that's involuntary contractions. So it's much more isolated and deeper to the muscle tissue that would take years of really training to really get in those same areas of type of contraction. That muscle memory, lifting weights for over 30 years now, it takes a lot of time to really truly engage the muscles you're trying to work and to isolate. So this helps isolate those areas that sometimes if you're untrained or deconditioned, you cannot get those muscles to fire. So it'll take a lot longer to get those results, where this machine does that work for you. So now it's not only just contracting muscles, it's contracting them very intentionally, the ones you're trying to recruit to get the body transformation, get the sculpting, the true sculpting to take place. And especially for people that do have some abdominal work they've done, and they have some areas they're just struggling with different areas that they can't get on their own, you can move this around and do some spot work. So even people that are athletes, or they're athletic competitors in physique or bodybuilding, will use these devices too, because they can hit those areas that oftentimes they'll have to compromise to continue to diet down, where this they can go and do some spot work as well. But not only that, it's also strengthening those core muscles that help protect the spine too. So people that have low back discomfort or chronic low back pain, This will help actually tighten up that as well to minimize some of that insult or inflammation in the low back area due to deconditioning as well. So it's multifactorial what this is doing. It's not just for the aesthetics, it's actually for the functionality as well.
Yeah, we can do arms as well, legs, the back, calves. And this is also really great treatment for people who are on GLP-1s because they are losing a lot of muscle mass. So this is a really great treatment to combine with that. We have our InBody scan, and the InBody shows muscle mass, and our patients who are doing Transform well on a GLP-1 are noticing their muscle mass staying pretty consistent throughout treatment versus people who aren't doing any treatments. It's really hard for them to get their protein intake. They're starting to lose some muscle mass. So how are you feeling? You want to go up a little bit?
Yes.
Okay. And we'll notice here too, we can see a really nice contraction as well on those muscles.
And the biggest thing as a client is trying to allow the machine to do the work, to really submit, to get a deeper contraction instead of trying to anticipate the contraction or fighting it, just allowing it to penetrate, because what will happen is after this runs through, it changes the neurology as well. So what it's going to do is turn these circuits back on for you and get these muscles to start firing again, especially if they've been deconditioned or haven't fired for a long time. And then what you'll notice is in between the sessions, you'll feel these muscles start to activate and start working that have been on, I call them retirement, and get them to start to fire again with your input being much more focused and concentrated when you do go to do ab work on your own.
Awesome. Want to go up a bit more?
Sure.
So that is our Transform treatment. If you have any questions about it, give us a call. We'll put that in our bio and down below in the comments as well. And we hope you guys can give it a try, especially our people who are on Semaglutides and Tirzepatide. Then they can give it a try and they can really help benefit them too.